Is it ADHD or something deeper? Let's dive into this conversation about, is it ADHD, a mood disorder, or maybe even something else? And we're going to, of course, be talking about nervous system dysregulation. How do these behaviors show up? Why are they so confusing, difficult to manage? And what is a secret tool that you just don't know about and that can really help you get a path that can help your child and family? And as I always like to say, not just your kid right now, but for the future and all the kids that come beyond that. Yeah, your generations that come beyond that. So let's talk about the confusion between mood issues, which, gosh, nobody ever seems to want to talk about. It seems like ADHD is always the diagnosis du jour and it's more acceptable. And not that there's anything wrong with being diagnosed with ADHD. It's just that if we're misdiagnosing, if we're leading people down a path of, yeah, your kid has ADHD or whatever issue they have, and it's not the right one, you're just not going to get the right help. And that's why people always want to, come in to see me and work with me. And if you do want to work with me, you can go to drroseann.com/help and you can take a 3-minute quick quiz. It's our solution matcher. And it's really about guiding you to the next best step because so many of you find me in a Google search or you find my podcast because you're desperate and you don't know what to do. And all of my work is to really empower parents and show you that path that helps to regulate the nervous system and break this cycle of dysregulation that seems to move from, generation to generation. So we can often mislabel kids with a mood disorder as ADHD very easily. We're going to talk about the similarities and differences. And in fact, I almost never get a kid with a mood disorder who didn't first have an ADHD diagnosis. And a big part of that reason is nobody wants to go there. Nobody wants to think, oh, this little boy, this little girl has mood issues. And recently, I worked with a family and they came to me, well, he has, people now use the word complex ADHD. I'm like, what issue isn't complex anymore? And of course, I did a brain map. We'll go into that. And I looked at his brain and I said, this isn't ADHD. This is a mood disorder. And I happened to have quite a few kids in that same situation happen. And I didn't honestly need a brain map to tell you that it was a mood disorder. All the signs and symptoms were there, and we'll talk about it. If you have a kid who, has big emotions, those long meltdowns, and you are constantly walking on eggshells to avoid blowouts, you really got to think potentially, is this a mood disorder? You also want to think about other things like anxiety, OCD, pandas, trauma, or even what we would call situational stressors. It's a lot more than that. Things like bullying, grief, and loss. They can turn on behaviors overnight. And trauma is a big word, right? So I always talk about little T's and big T's. So big traumas is exactly what you're thinking about, extreme, long-term bullying, sexual or physical abuse. But it also can be everything from, the ending of a best friendship or a medical trauma. There could be a huge list of things, right? We don't limit what trauma is. The body is what determines what trauma is. Because for some people, right, two people can experience awful events or benign things, right? Sensory, food aversions, and the body is reacting differently. And we don't really know why that is. All we know is that what you bring to the table in stress and in trauma is what actually helps you to get through it. If you have a history of high levels of stress and you experience a traumatic event, it's much more likely to stick within that body and show up. And certainly, what are other things that could affect a kid's mood is parent dysregulation. So if you're a highly dysregulated parent, do not expect your kid to have it together if you don't. I constantly deal, with individuals who somehow believe again, here's my magic wand, that there's some magic wand in when people work with me in our brain behavior reset program where we have to improve the child without improving themselves. Now, I don't get a lot of those parents anymore because they're listening right now and you're realizing Dr. Rowe is not the person for me because this is an ecosystem we improve. Regulating a dysregulated kid with a mood disorder or complex ADHD is actually very easy with our tools and what we do. It is the larger part. It's brain behavior. It's learning new behaviors, right? And some of that is just habits in the brain of the child, habits in the brain of the parent, the stuff they bring to the table. And again, no shame. This is about educating. So we can't go in and expect our kid to regulate when we can't regulate ourselves. Please know that I do completely understand as a mom of a PANS kid that there are, it's the dog chasing its tail, right? So your kid dysregulates and then you're trying to hold it together and you dysregulate. So let's talk about the basics of ADHD versus mood disorders. What's that overlap? I mean, honestly, the biggest overlap is poor impulse control. And that poor impulse control runs the gamut in terms of all the things that it leads to, right? So poor impulse control leads to low frustration tolerance, right? Not learning. You're doing so many good things and they're just not absorbing and they're just not learning because their nervous system is too dysregulated to allow that. Kids with ADHD and mood disorders always have poor executive functioning because the impulse control, right? But kids with ADHD, what are the basics? They, of course, as I already noted, impulse control, hyperactivity, inattention, where mood disorder is more about that reactivity. It's about the mood swings, the rage, the extreme difficulties in dealing with everyday kind of things. I call those benign things. And just having a chronic level of irritability. Key difference is ADHD is much more consistent, right? So there's a constancy of difficulty in, focusing, impulse control, filtering noises, switching attention, where mood issues kind of comes in waves and crashes. There's a lot more volatility. Now, even within that, we know that people with ADHD, 70% have, it's not in the DSM, something called reactive sensitivity disorder. Again, not a clinical disorder in the DSM, but they react too strongly to perceived or real criticism. There's a lot of overlap between ADHD with reactive, RSD and mood disorder. I feel that there is probably a lot more kids who are falling into that ADHD diagnosis and adults, but really they have a mood disorder, right? And what are mood disorders mistaken for ADHD? So certainly disruptive mood dysregulation disorder, DMDD, and that's sort of that chronic level of dysregulation. It's what honestly brings a lot of kids to me. Pediatric bipolar disorder, depression. You see this a lot in boys because they tend to be more irritable, angry, and they have those big behaviors. So they might have aggressive talk or aggressive behavior. So they're more likely to get flagged. Even within that, I will also see common diagnoses that go along with ADHD. I tend to get a lot of shopping cart diagnoses with kids that really have a mood disorder. So they'll have ADHD, oppositional defiant disorder, potentially anxiety or other things. And yet we never seem to actually label somebody with mood disorder. What I find in my clinical history, you have these highly dysregulated reactive kids, and it is a long time before they get diagnosed, often not until young adulthood, teenage, young adulthood, or later. And what winds up happening is they come in for a brain map. Just know that emotional dysregulation, right? It's the brain's ability, to recover from stress, right? So people with emotional dysregulation recover poorly from stress. And stressors are real or imagined. Let me say that again. Stressors are real or imagined because what we perceive as a stressor is often not what parents or grandparents seat as a stressor. When we have older kids, we always think it's bad behavior. They're doing it on purpose. They're willful. And instead, I want you to reframe that and say, my child's nervous system is overloaded. And when you do that, in our comms protocol, the A, you avoid personalizing the behavior. And that's really important to do because you can be more present, you can be more connected, and you can help. When you're really considering mood issues, they're quick to anchor over seemingly things that we just don't know. We may not make connections. They may not be immediate. It may not be that you told them they couldn't do something, but it was 3 hours before and they just were holding it in, right? They are very poor recoverers after outbursts. I mean, I've had parents tell me, what do you mean kids recover? Meaning that this kid would, would take a day or longer, a week. I think one of the coolest parts about when they work with us in our brain behavior reset program, combining neurofeedback and PEMF and a lot of ways that we regulate the nervous system is they always soften. It doesn't matter what the issue is. As soon as there's dysregulation, whether it's from, autism and reactivity of that nervous system taking in too much stuff, or it's a mood disorder, or it's a kid with PANS or OCD, or a kid with, ADHD, will always soften the behaviors. Why? Because they can regulate. So when somebody with dysregulation who's always overreacting to small things, how can you recover? Because you're living in that sympathetic overreactive, right? So we know common triggers, right? I would say the number one trigger is probably transitioning, particularly from ending screen time or having to end a task and go to a preferred task to a non-preferred task, or leaving the house, right? We know sensory is always an issue for kids with mood disorders and definitely for ADHD. Lights, noise, crowds, events of kinds can really be triggering, even things that we would perceive as happy. I remember when Max was like in the throes of his PANS, he was great on trips. But he had horrible anticipatory anxiety, and he would just react so strongly to things. So what did I do? We never told him we were going on a trip. So we would say, today we're going, it was always at Disney World because they were like the best gluten-free place around. And we would say, we're going to Disney World today. And he'd be like, okay. And there was none of that breaking down that would happen. I know other parents can relate to this. This is what happened at birthday parties. He would just fall apart on those kinds of things. As a parent, Chris and I, Mr. Hodge and I would look at it and be like, well, this is going to be a great time. What is he freaking out at? But we didn't do that. We would say, it's just Max. His nervous system is reacting. And it was very freeing. Please know that, instead of being confused by it. Kids that have mood disorders and struggle with regulation often feel that things aren't fair. They feel rejected. They feel criticized. Some of that is completely internal and that inner dialogue. And some of that can be because they're constantly corrected. We often correct these kinds of kids instead of trying to connect. And I'm not saying it's easy, right? As my dad, Tony, would say, it's easy with the mouth, Roseann. I always walk the walk. I don't just talk the talk, because I get it. But it is not easy to connect with a kid who's always putting up the wall, but there are ways, right? We know that hunger, fatigue, overscheduling can be a trigger, and hunger is a really dual-edged sword, because a lot of these kids are medicated with ADD medications, and that just cuts the hunger, and then they're eating less, they're not getting enough nutrients, and they react more. So it's not always a good thing, right? Or they have sensory issues to prevent with dysregulation. It's that their emotional needs are not being met. They feel misunderstood. They feel unloved. They feel ashamed. We have to honor that about our kids, because we're confused. We're having a hard time. We're like, why is this dysregulation going on? Why, and then you have people whispering in your ear like, okay, Betty. I mean, you're just not parenting right. I mean, you just need to discipline them. So you have to reframe. These aren't manipulative behaviors. they're a sign of that dysregulated nervous system. And when you start really leaning into that, and hopefully you have a partner, the grandparent, your bestie, you have people who hear you and support you because you need a community. It's so isolating. So freaking isolating. There isn't a person, including myself, who doesn't read the first chapter of my next book and cries, doesn't cry. I'm gonna have to practice it, because you've already heard me say it's called The Bitches on the Bus Stop. And it's really about that isolation that we experience when you have a really reactive, dysregulated kid, regardless. So, how can a brain map, how do you get to this root cause? How do you figure this out? So, for me, it's really about you're going to a really seasoned professional, right? This isn't somebody who's just out of school. This isn't somebody who's necessarily attached to a fancy institution. I find that to be one of the worst places to go to, these hospitals that just churn people out. And they also have a framework, right? So just know it takes 20 to 30 years for a concept or a technique or a method to become even possibility of mainstream. And I would say it's over 30 years, being that this is the third decade. You're 33, that I've been working in the field. And so what does that mean for you is that if you're working with somebody who's in a very traditional institution, the likelihood that they're going to be a professional who wants to put the pieces together in a way that I don't even want to say is outside of the box, but really is evidence-based and is not just driven by pharma, because the DSM, the Diagnostic and Statistical Manual, matches up beautifully with pharma. And so we have to think, right? That is what I use. I do use the DSM, but it's also about clinical experience and being willing to put that together. So I use objective data. I use a brain map, and you don't have to guess what's going on because it shows you exactly why your kid's exploding, why they're reactive and they can't calm down. It's going to show you where the brain is overstimulated, where the brain is understimulated, because both can produce depression, big behaviors, emotional reactivity, right? When we have a lot of emotional reactivity, right, what we often see is too much activity here in the limbic system, right? That's that emotional center, right? Sometimes I even see understimulation, right? Because the brain is worn out in that area. And so they don't know how to filter anything out. And then it gets the way it works in the brain is the frontal lobes. Should you feel something, your frontal lobe should help you to process that, logically process that. But when you're running hot, your kid is just in the red and too reactive. All of those systems go offline. They are not hearing you. You're trying to be a good parent. Best thing you can do is give them a love pause and get in there and try to connect with them, because it's the only way, right? You can be their emotional anchor, and you can only do that when you do the C and the comms, which is co-regulate. When you're looking at these, brain patterns, even that understimulation, right? So is the frontal lobe offline? We get a real sense when we look. It gives us a visual representation of the exact areas that are working and not working. And what you may see is things like high beta, which, beta is a focused brainwave, but if you see too much of it, you're going to see a lot of anxiety. You might see too much alpha. So mood disorders most commonly show up as having too much alpha diffusely everywhere in the brain, largely frontally and over the motor cortex, but it can be anywhere. Even though alpha is an amazing brainwave, it's like your feel-good brainwave. When you meditate, alpha comes out. But when you have too much of it, it produces anger and irritation. What I always tell my people when I'm training somebody to work with me is, do you remember when you're in college and you were hanging out with like this, great person, and they drank alcohol and then they became like this angry, irritated person, and then you were kind of scared to ever hang out with them again? That is somebody that had too much alpha. And so they had probably a natural propensity towards mood disorder, and the alcohol just flips a switch on them, right? So we have to be very cognizant of the brainwave patterns. They tell us what's going on. They tell us what to do. They tell us what can be helpful. Why does this matter? It takes the guesswork out I mean, hello. It shortens the time that your child is struggling. I mean, it's so infuriating to me that this isn't a standard of care. I really thought it would be. And it also really leads to more targeted treatment. When people come in and do a brain map with me, we're able to just say, okay, this would benefit you and that would benefit you. I recently had somebody with a mood disorder come in. I really wanted them to do some functional lab work before they even came to me because I was suspecting some different components. And they had a very layered, complex case with multiple medical issues. It wasn't just a mood disorder. But the mood disorder was very apparent in the brain. I needed some things checked, including your thyroid and all that other stuff. And that was the right ethical thing to do. The great part is that the brain map cleared up a lot, and they had been to, oh gosh, at least 15 medical doctors, including neurologists who were sort of puzzled by things. Honestly, the brain map really did help us to put the pieces together, but a really good clinical intake with me could have gotten them probably 80% there, just based on it. And the mom said to me, we've gone to at least 15 doctors and nobody's been able to give us the clarity you have in an hour and a half. And people say that all the time to me, and I'm glad they get that clarity, but we should be using these tools. That's how amazing this brain map is. People go and get a 15-minute intake with a pediatrician or, maybe longer with a psychiatrist. But that's why so many people are getting an ADHD diagnosis, right? And there are times when kids are sensory and have ADHD and are very emotionally dysregulated. I would also have you consider autism, depending on the symptoms, because kids with those patterns often don't get properly diagnosed. And people don't understand autism in this still to this day, right? But you need the right diagnostic information. So what do you do next when you really think, hey, Roseann, I'm hearing you. My kid's got this ADHD diagnosis. I've tried meds. I've tried OT. I've tried an IEP or a 504 with the school, right? I've tried different parenting techniques, and my kid is irritated, angry. We're walking on eggshells, right? My kid is very poor recovery. They dysregulate frequently. So the outbursts are frequent, not occasional. Because remember, all kids dysregulate. Don't think if your kid dysregulates, they have a clinical issue, because the rise in kids parents trying to think, okay, my kid's dysregulating, there must be a clinical problem. That rise is out of control. And there are definitely times where I have both extremes where I'm like, how did you never get a diagnosis and you're 23 years old and I'm the first person you've seen, versus, okay, well, my kid's dysregulating, they must have ADHD because I didn't do that. Well, dysregulation is normal to a point. It's that intensity, frequency, and duration is occurring at a high level. So that's the first thing you need to do, is you need to ask yourself that question. The next thing you need to do is you need to say, who's my trusted person that I can get help from, right? So you can go to drroseann.com/help, and you can take our solution matcher. And that's really going to help guide you in that right direction. Is the only way to work one-on-one with me. We have lots of options. You want to consider a brain map. Who's the person that can help you? And please listen to my other episode on brain maps. Don't expect you're going to go to Joe Schmo provider or somebody who doesn't have the clinical experience to tie the behavior, also diagnostic experience, with the brain map. There's lots of people given brain maps, including, medical doctors, chiropractors, therapists, all kinds of people. And unfortunately, there's unlicensed people who are doing it, right? I was pitched recently from somebody who was unlicensed in their state of New York, which is completely illegal to be operating and doing anything related to neurofeedback unless you're under somebody else. And she had trained another provider and was pitching me to train me. And I was like, what are you doing? This kind of stuff scares me, because you want to make sure your people are board certified and qualified. But on top of that, you want to make sure that they have clinical experience in that specific area that you need. You want to make sure that next parent step, besides getting somebody who really can dig deep with you and help you and guide you in the right direction, is you want to offer calming strategies not correction. And the first part of that is, in our comms is the C is co-regulation. So you've got to put your oxygen mask on first before you attempt to put it on your child. But don't feel that if you're offering love to your child, hugs, a hand, a soft word, that you're giving in, you're approving what they're doing. You're not, this isn't something that's going to be fixed with discipline. You already know that. Parents get really stuck. So you got to regulate yourself first. That's step one in comms before you can go in and give help. The definition of insanity is to do the same thing over and over and expect a different result. That's what Einstein says. And I couldn't agree more. So if you're doing things and it's not working, don't look for another med. Don't look for all those components, because what we have to really think about is, what does your child need? They need you to regulate, and your child needs you to be that anchor. We need to offer kids more emotional support. Yes, that's exactly what we need to do. And I'm being honest, it's not easy unless you're regulating yourself. So if you think your child has ADHD and they're emotionally reactive and it's a constant, and the things you've been doing, you're like, hey, Dr. Rowe, I'm doing a pretty good job parenting. My other kids are okay. And this kid is really still struggling and I don't know how to support them. I really want you to think maybe the ADHD diagnosis isn't there, and mood disorders are much more common than we realize. And instead of wading through and trying to figure it out, get a brain map, find an awesome provider. I'd love to be that provider for you. And you can go to www.drroseann.com/help and you can take our solution matcher. I hope this was helpful, and please drop in the comment ways that this video kind of helped you and got you to think differently, because I really do appreciate, we do look at all those. Good luck on your journey wherever it leads you. You're going in the right direction.